Welcome to Lecto. Today we are going to discuss second layer of the eye, and that is the vascular layer. So as we know that the eye consists of three layers or three cords: fibrous cords, vascular and the neural. So if you see here, first one is the fibrous cord, or you can say fibrous layer, which we have discussed. Okay. Second is the vascular layer. Okay. And third is the neural layer. Okay. So fibrous layer, or you can say corneoscleral layer, it has two components. First is the sclera and second is the cornea. So if you see here, the outermost layer that is actually posterior to the eye will be the sclera, and if it move anterior to the eye, then it will become the cornea. Here is the cornea. Okay. And it forms the fibrous cord. Okay. Next is the vascular layer. That is also called the tunica vasculosa. It has lot of several names. So tunica vasculosa, or you can say uvea or uveal layer. So again, it has three components: vascular layer, tunica vasculosa, and uvea has three components. So actually we divide it into three. First is the choroid component, second is the ciliary body, and the third component will be the iris. So if you see here, middle layer will be the choroid, and if you see ciliary body actually present at the anterior side of the eye, that is the ciliary body, and the iris, this is the iris. When you see the anterior view of the iris, then the iris will look like this way: circular and the radial. This is the iris, and the opening will be the pupil. The opening will be the pupil. So here is the basic structures of the iris. Okay, and last is the neural layer, or you can say retinal layer. But in this lecture, we will just focus on the first component of the second layer, that is the choroid. Okay, we will just discuss in detail the choroid. Okay. Now, as we know that the outermost is the sclera, next layer is the choroid, and the innermost will be the neural layer, or you can say retina. Okay. If you see here that the outermost will be the sclera. Okay. And next layer is the choroid. Here is the layer of the choroid. Okay, this is the choroid. So choroid layer is actually a thin, highly vascular. So it has basically different features, that it is actually a thin layer, highly vascular layer. Lot of blood vessels actually present in the choroid layer, and it is actually dark brown in color. It means that it has pigment producing cell, that is melanocytes. So it means that it is dark brown due to the presence of the melanocyte in this layer, that is the choroid. Okay. Actually, the thickness of the choroid is 0.25 millimeter. So thickness will be the 0.25 millimeter. But this thickness will be at the posterior sides of the choroid. When it moves to the anterior side of the eye, then the thickness will reduce to 0.1 millimeter. So it has variable. There is a variation in the thickness of the choroid. At the posterior side, the thickness will be the 0.25 millimeter. When it moves anteriorly at the ciliary body side, then the thickness will reduce to 0.1 millimeter. Okay. Now the outermost will be the sclera, that is the middle one, and the last will be the, if you see here, last layer will be the retina. Okay. So actually the space that is actually present between the sclera and the choroid will be the perichoroidal space. So this space that is actually lie between the sclera and the choroid, perichoroidal space. Why do we call it peri? Peri means around. So actually this space is around the choroid. So that's why we call it perichoroidal space. Okay. We divide the choroid into 3 layers. So again, we divide choroid into 3 layers. First one is the choroid stroma. This is the first layer of the choroid. Second layer will be the choroid capillary layer, and third one will be the Brooks membrane, and it has another name, that is the lamina vitrea. Brooks membrane also called lamina vitrea. Okay. So we divide the choroid into 3 layers. Okay, here are basically the 3 layers of the choroid. First is the choroid stroma. In the choroid stroma, you will see most different types of the cells that are actually, or different fibers that are actually present in the choroid stroma. So most importantly, 2 main fibers actually present in this, elastic fiber and the collagen type 1 fibers actually present in the first layer, and that is the choroid stroma. So if you see here, like this way, collagen and the elastic fibers actually present in this layer. Okay, and in the space that is actually present between these fibers, you will see the different types of the cell in the space. So first cell, if you see here, in between these fibers you will see different types of cell, that is FMB. So you will remember it by the first is the fibroblast that are actually involved in the formations of the different fibers. You will also see the macrophage and melanocytes, and last is the blood vessels. You also see the blood vessel in this layer, veins and the arteries that are actually present in between the spaces of these fibers. Fibroblast, macrophage, melanocytes, as we know that the melanocytes produce the pigment melanin, and that gives the brown color to the choroid layer, and the blood vessels, arteries and the veins. Okay. Next layer is the choroid capillary. So here is the choroid capillary. In this layer you will see the mesh or the plexus of the fenestrated capillaries. You will see the mesh or fenestrations of the capillary. So in this layer you will see the fenestrated capillaries. Okay. Fenestrated means that if you see here is the capillary. Okay. And this capillary has lot of pores in it. That is called the fenestrated capillary. Capillary having lot of fenestration. This is the that lie in this layer. And you will see the plexus or mesh of the capillary in this layer. This is the one thing. Okay. And now nutrients actually flow or they pass from this layer and provide nutrients to the retina layer. So retina actually gets nutrients from the choroid capillary. Okay. And again you see the spaces that are actually present between the choriocapillaries is again you will see the presence of the lot of fibers and the cell. Again you will see the presence of the elastic and the collagen type 1 fibers also present in this layer. And you also see these components: fibroblast, macrophage, melanocyte. These components also present in this layer as well. So these components, these fiber and these cells present also in this layer. Okay. And last is the Bruch membranes, or you can say lamina vitrea. So we divide it into again 5 layers. Okay. Again we divide this layer, last layer, into 5 components. So first layer is the basal lamella of endothelium of choroid capillary. So first this one, this layer is actually the basal lamina of endothelium of choroid capillary. So actually it is the basal lamella, basal membrane or basement membrane of the choriocapillary. And last is actually fifth one will be the basal lamella of the retinal endothelium. So actually you will see this is the retina and you will see the epithelium, retinal epithelium. So actually this last layer form the basement membrane of the retinal epithelium. So actually we call the last layer will be the basal lamina of retinal epithelium. Okay. And second one will be this layer. This layer will be the external collagen layer. And fourth one will be the internal collagen layer. This is actually the external, this is the internal. And at the center layer will be the elastic layer. And you will see the mesh of the elastic fiber in this layer. So here are basically the 5 components of the Bruch membrane, or you can say lamina vitrea. So at basal, these are basically upside and the down. You will see the basement membrane. Second and the fourth will be the collagen layer, and center will be the elastic layer mesh. So this is all about the choroid. If you have any question, you may ask in the comment section. Thank you so much.